Next product company we have up is Barkle. Barkle is a wonderful mouthwash company, and we have Dr. Henry Crisanti, if I'm pronouncing it correctly. He'll be doing our post introduction, but in the meantime, please take a look at the video that Barkle has provided.
My name is Dr. Henry Crisanti, and I'm a retired periodontist who practiced in Chicago for over 42 years. In 2018, a group of dental specialists, myself and a PhD chemist, developed an antimicrobial rinse to treat and prevent periodontal disease, decay, breath odor, and alleviate the symptoms of dry mouth in humans. We tested the formula using 6 beta testing sites to validate clinical outcome of the formula. The former dean of the University of Pennsylvania, a very famous periodontist by the name of Dr. Walter Cohn, in 2020, after reviewing our data, suggested we direct our attention to periodontal crisis in the canine world. Penn's dental school had a very close relationship with the School of Veterinary Medicine. We focused our research on canine space, and in January 2024, we launched our canine formula, Barkle, at the VMX show in Orlando. As dental specialists, we would very much like Barkle independently evaluated by the authorities in veterinary oral care, the dental veterinary specialists. Barkle came on the market, classified by the FDA as a medical device. We have safety data studies done on the gel, and we have toxicology studies by NAPSA for the ingredients. We have bacterial lab testing against Porphyromonas gula, the biomarker for periodontal disease in the canine. Our FDA advisor has devised a 60-day study to validate our clinical exam, that if it is used daily, Barkle will be more effective in controlling plaque control than brushing. Barkle claims are based on the following science. Periodontal disease in the canine is due to uncontrolled growth of normal flora. Plaque biofilm must be controlled or disrupted daily to maintain a non-inflammatory oral balance. The gold standard for plaque control in both the human and canine space is daily brushing. Canines find brushing intrusive and as such are very resistant to it. Only 5% of dog owners brush their pets' teeth daily. Plaque develops initially on the facial surfaces of the canine's teeth, and the canine's breath odor is proportional to the degree of periodontal inflammation. Barkle is a tasteless, odorless gel that, when applied to the surfaces of the teeth, sticks and is difficult to remove because of the limited tongue action to those facial surfaces by the dog, therefore allowing prolonged contact. To be preventative, Barkle must be applied daily, similar to human oral hygiene. It's a halogen-based formula that kills bacteria and viruses due to radical chemistry and does not require metabolism similar to antibiotics. The ingredients in Barkle are used for water and food purification all over the world. Application of the maxillary and mandibular teeth should take less than 2 minutes, and dogs actually find the application of the gel by coating the teeth a bonding issue and anticipate it. If you would like to personally evaluate the product, we will forward samples and the FDA protocol for your evaluation. As experts in canine oral health, we're hoping that you will participate in our FDA study and provide your personal evaluation as an option to replace daily brushing. It is our hope that utilization of Barkle will be overseen and directed by veterinarians. Barkle can be purchased individually or as a monthly subscription with a discount.
Wonderful. Thank you very much, Barkle. And we have Henry, who's going to be on this side to give a little bit more information about Barkle.
Here we go.
Hello, how are you? How's it going, my dear?
I'm good. I'm good. Now that I know how to spay dogs, I may change my profession.
You're good. No worries. So tell us a little bit about Barkle.
I want to kind of make a comment about Barkle and what we as dentists have found when we got into the veterinary oral health world. Mm-hmm. And it was sort of surprising. When Barkle was developed, before we launched it, we had Brakle do a survey for they used 300 vets and 500 pet owners. And what basically they discovered is that all the vets, 100%, thought that 9 out of the 10 dogs they saw had periodontal disease. But only 50% of the pet owners thought their dog had a problem.
Oh.
And I think that one of the things that's obviously going to have to happen for the oral care health of dogs to change is going to be education of the pet owner. I do not think they understand the correlation between their personal oral hygiene and the dogs. And that means that if you brush your teeth every day to maintain oral health, you have to do the same thing to the dog, or ultimately it's not going to work. If you try and tell your dentist that you're going to brush your teeth every other day, you'll see the reaction that they give you. And the reason is I don't think there's a complete understanding that the design of the disease, a bacterial disease for periodontal disease in humans and dogs, is exactly the same. It's just different bacteria. And that's a big problem. And what we're hearing from the vets is that they're tired of telling people they have to brush the dog's teeth every day because they don't do it. And the reason they don't do it is dogs don't like it. So Barkle gives you the opportunity to control their oral health and prevent them from getting severe periodontal disease, but it's got to be done daily. But the good news is it takes less than 2 minutes, and dogs, as much as they dislike brushing, they love having their gums massaged. This is an option for the concerned pet owner, and I think that one of the things that's going to have to happen is that the pet owner has got to understand the consequences of ignoring the dog's oral health. And one of those is shortening the life expectancy of the dog by as much as 2 years and affecting their overall behavior. And one of the things that we talked a lot about was when we were doing this is that if you've ever had a toothache, can you imagine what a dog feels like that's gone 3 years without having any kind of oral care?
Yeah.
They obviously don't complain, but a lot of behavior changes that occurs that is assumed to be aging, and it may not be. So, and the consequences of allowing periodontal disease to get is severe is that it affects the major organs and again can affect life expectancy. Now, here's the thing that we were very perplexed by. 85% of dogs over the age of 3 have periodontal disease to some degree. Only 5% of gross income for vet practices or corporate practices comes from canine oral care. So you have the number one infection minimized by the smallest amount of gross income. And when I was listening to the gentleman talking about spaying and neutering and how that should become a major part of the vet's income, so should oral care. What we're proposing with Barkle is that if the owner uses the product daily, then the dog should be brought in twice a year for an exam and a polish without anesthesia, okay, as part of the routine to make sure that everything's going the way it should do. All that can be done by auxiliaries. And so it's a way to turn a non-profitable nightmare into a profit center and at the same time benefit the animals. Now, one of the things that we suggested is that if I was a veterinarian and I was in practice and I was interested in canine oral care, what I would do with Barkle is every dog that came into the clinic, I would do a quick 2-minute demo on applying it and show them how easy it is and how the dog responds, and then say to them, this is something you ought to consider for your pet's oral health. Because the clinical trials that we did were not on symptoms, they were against the bacteria that caused the actual problem with DNA, bacterial DNA testing. And we know that it is a more efficient replacement if used as directed than toothbrushing is.
Wonderful, wonderful. I actually have a sample right here, and it says that it's a gel.
Yeah, it's a gel. Yeah, it's a gel. Comes in a airless pump, and it as I said, it's sticky, so it sticks to the outside of the dog's teeth.
Mhm.
Dogs can't get their tongue on it. It's not a movement that's easy to them. And when we were at the show, when people were telling me, well, is it safe? You know, we would say it's perfectly safe. Okay, it's exactly the same ingredients that was in the human prescription. The only difference is it's in gel form.
Wonderful,
So
wonderful.
if the dog can use tolerate tap water, they'll have no problem with the ingredients of Barkle.
That's wonderful, wonderful. And for all of our viewers out there, if you're interested, we do have Barkle as part of our expo. He and his team are going to be available from until 6 o'clock today to do some questions and answers. If you're interested in purchasing or finding a little bit more about the product, please go to dvmcentral.com, click on the Barkle storefront, and make your purchase today. Thank you very much, Henry. I think we greatly appreciate your time.
Okay, thank you.
Sure. We'll see you next time.
Okay.
Bye.